Hi friends, I am Dr. Vishal Gupta and I am a consultant pulmonologist at the Chest Care Clinic Kharghar in Navi Mumbai. Today, let us discuss an important topic. When do you see a pulmonologist or a respiratory disease specialist? A respiratory disease specialist, also called a pulmonologist, is somebody who specializes with lung and related diseases. So it is important that if you have a lung disease or you're suspecting a lung disease, at that time you should be able to see a lung specialist if it is not getting better after some medicines by a local doctor or by a physician. So, if you've been having conditions like breathing difficulty, coughing, or chest heaviness, which can be a symptom of asthma or airway diseases like COPD, emphysema, or bronchitis, or even a regular viral infection which is not getting better after a one or two courses of medications, it is recommended that you should speak to a pulmonologist or a respiratory disease specialist. If you've been having any symptoms where you've had a weight loss or there has been a cough with more than yellow color sputum like green color sputum or any blood in the sputum, which we often call as hemoptysis, or there has been any recurrent episodes of cough which has been going on for more than 2 or 3 months, we should be able to discuss this with a doctor, and a pulmonologist should be able to help you out finding the right cause of this particular problem and to solve this problem completely. It is also important that if you've been having respiratory diseases in the past, so if you've been using inhalers, if you have been on oxygen, if you've been hospitalized for a long time and you had home oxygen, or you were using certain medicines which are very unique to respiratory diseases at home, then at that time you should always discuss this with your doctor, especially a pulmonologist, because they understand these things better than others, and also they can help you get a solution which is more effective to your particular condition. So we often deal with a lot of conditions which are like asthma, but they are not exactly treated with inhalers all the time, or there are many different kinds of inhalers that we have to use to treat different conditions. But it is important to look at the conditions individually and try to get a solution for them. If there has been any chest pain which has been troubling you, especially waking up at night with some breathing difficulty or coughing, it is important to see a pulmonologist because you may be having early signs of either tuberculosis infection or any gland in the chest or maybe lung cancer. Then it may be important to take a decision forward. If you have smoking related habits or tobacco habits which have been difficult to manage, a nicotine cessation plan can be planned with your pulmonologist, which is probably an allied part along with psychiatrist doctors. But many a times, a pulmonologist can provide some motivation and some medications which will help in the symptoms of tobacco and nicotine cessation work more effectively. If you've been diagnosed with sleep apnea or you suspect that there is a difficulty in breathing during sleep, then it probably makes sense to speak to a pulmonologist about it for further guidance, and this may help your case get even better. So there are certain conditions in which somebody who doesn't have a respiratory disease, that is those who have gone for a pre-medical health checkup or for insurance purposes or for their employer health checkup, and they have found certain problems in their X-ray or in their lung function or on a CT scan done for other reasons. And when they find these problems, they don't know the right person to contact them. The right person is actually a pulmonologist who can guide you as to what these problems may indicate and how to get a complete solution from them and how should this problem be followed up. They can also advise on the fitness and the travel perspectives and also the future outcome of these issues, which can help some decision making very easy and a long term successful outcome for the person himself. So always remember that lung diseases are not incurable diseases or very difficult to treat diseases, and they're not very expensive diseases unless they have been made unnecessarily. And they can be quite alleviated by speaking to the pulmonologist, and they can provide a long-term solution which can potentially cure you from these particular issues. And therefore, always speak to a pulmonologist before giving up on hope, and that may be the last resort on unfortunately is still there many times in India, but we will try to curtail this to the best limit that we can. We also encourage our patients to give a feedback, so you can check out our feedback from our patients on the YouTube and on the Google page. If you would like to contact us, you can always do that on the link given in the description box below. And if you have some comments for us or on this video, you can drop them in the description box below. If you like this video, don't forget to share it. And if you feel that someone else can be helped by this information, always share this video to others as well on your social platforms. And if you want to watch more such videos, don't forget to subscribe to our YouTube channel. Till then, take care and breathe easy.